Yeah, so as you're starting to think about what you should bring to the table when you're going to meet with a health plan, there are a couple of things that come to mind. The first thing I always like to bring is a story, a very short story, and I like to think of a patient. I always bring Frank in my mind, an 87-year-old man with kidney disease and heart failure and 3 prior ER visits, which resulted in hospital admissions, who we found actually by identifying him through high utilization. He was enrolled in home-based palliative care and in fact didn't go back again to the hospital. So if you have a picture or a story or something very short that you can explain what it is you do and what your expertise in palliative care is that results in preventing avoidable hospital admissions, that's helpful. The second thing I like to do is have some kind of volume metrics that you've already achieved, some kind of outcomes and volume metrics. So how many patients you've seen already, and out of those that have died, how many have been able to be at home? So in our program, 87% of the patients who die at home, either with us or with a hospice program. And in usual care in our market, that's 25%. So it's a huge difference. And when you ask most people where would they like to be when they die, most people would say at home. So if you can somehow start to look at your preliminary data as to where the location of death is home for what percent of your patients, if you have that data, that's very helpful. Another thing to bring is your hospice referral rate and length of stay. And that's very important to a Medicare Advantage plan because right now that's a carve-out for the Medicare Advantage plan. And so it's preferable in a Medicare Advantage plan that those patients that are hospice eligible are transitioned over in a timely fashion because then they're rolled off the health plan. So if you know your median and mean length of stay in hospice and you can share that with the health plan, that's also very, very good. And then any kind of satisfaction score could be useful. We've started piloting the Net Promoter Score. How likely are you to recommend this home-based palliative care program to your friends and family who might need it? And it's a score from 0 to 10. And so we look at how likely the patient, while they're receiving the care, is to evaluate the program. And then we can calculate that score so that we know while they're getting the care, how it's doing for them. Another metric to follow might be quality of life, although that's a very hard metric to impact on, and it's important to measure it because that's what matters to people. What we do with it is a different issue, but at least starting to ask about it, exploring that with patients, and tracking that, I think, is very helpful.